Hey everyone, this week the president was diagnosed with basal cell carcinoma. Now, thankfully, this was fully removed, but this is one of the most common skin cancers that exist. So I wanted to take a minute to talk about exactly what this looks like and what this looks like on people who look like me. Our basal cells reside in the epidermis, or one of the outer layers of our skin, and UV light from sunlight damages the DNA in our cells, which causes the production of malfunctioning cells or cancer cells, like carcinoma. When I was in medical school, first learning about these concepts in dermatology and pathology, I found that they were most often taught through the prism of white skin, or in comparison to white skin. And as you can imagine, that leaves many providers ill-equipped and many patients of color left behind in terms of getting an accurate diagnosis and timely treatment. Because of the mechanism with exposure to UV light and the production of cancer cells, basal cell carcinoma is most often found on the sun-exposed areas, like the scalp or the neck or the hands, but it can also be found anywhere in the body. One of the most common presentations that patients have when they're first diagnosed with something like basal cell carcinoma is the wound that just won't heal right. And it's often described in a variety of ways, most often on skin that's not pigmented. They can describe it as nodular, erythematous, or red. Sometimes it can even look like a crusted or scabbed lesion that is hyperpigmented or darker than the person's natural skin. Now, opposed to what you commonly find if you looked up basal cell carcinoma, similar to the prior photos, which can be described as flesh-colored or translucent or see-through or erythematous, where you can look closely and see blood vessels coursing through them. For patients of color, and this is an example of a basal cell carcinoma, they can often present waxy or very, very dark in nature, which can very much look like an innocuous scab. And this is another example of a basal cell carcinoma found behind a patient's ear. And this is another case of basal cell carcinoma found on a patient's foot. And since we're on the topic, this is a case of squamous cell carcinoma, another common type of skin cancer found on a patient's finger. Now, thankfully, basal cell carcinoma is treatable with a high success rate with excision or removal. But if this carcinoma is left untreated, it can damage the nearby structures and be incredibly disfiguring. So I say that all to say is that make sure you take the time to examine yourself. If you feel like you don't like the opinion of your provider, get a second one, and also encourage your older relatives and loved ones to get skin exams. It's a simple conversation that I really think can save a life. All right, talk soon.